Hello everyone, welcome to my channel RX Diary Girl. My name is Cheryl Suryak and I've been a licensed pharmacist in Canada for the past 17 years. My pharmacy journey began with my education in India. It started off with a diploma in pharmacy and then a degree in pharmacy, after which I immigrated to Canada. I went on to do the pharmacy licensing exams, got my license here as a pharmacist, worked for some time, and then went on to finish my doctorate of pharmacy from the University of Toronto. Currently, I work as a hospital pharmacist here. In today's episode, we'll be discussing about some of the pharmacy courses that's available in India, and it's meant for people who are looking to enter the profession. We will discuss about the number of years of each courses, the approximate salary, the scope of education once you're finished it. So we'll start off with the different courses that's available in India. So mainly there's Diploma in Pharmacy, which is a 2-year program. There's Bachelor of Pharmacy, which is a degree program, which is a 4-year program. Then those who want to do a post-graduation, there's M.Pharmacy, and then finally there's the Doctorate of Pharmacy, which is a doctorate degree. So these are the different courses that's available. Let's start off with the Diploma in Pharmacy. So this course is meant for people who don't want to invest a lot of time in education and they're happy with the diploma. You need to have your grade 12 with science subjects and then you can apply for this course. So it's a pretty intense program where a lot of information is crammed into the 2 years. You need to work pretty hard to pass the exams. So it's a 2-year program, as I said, and once you finish it, you will be getting your diploma in pharmacy, with which you will be able to register with your local pharmacy council. Once you become registered there, you get your license as a pharmacist and you can open your own medical store or retail pharmacy. You can even go on to open your own wholesale pharmacy, or you can choose to work in a government hospital if you pass the necessary exams. So these are the main scope of practice once you've finished diploma in pharmacy. This is, as I said, mainly meant for people who don't want to spend a lot of time studying, are not very particular about having a degree, they're happy with the diploma, and it's also good for people who wants to get into business because it makes them be eligible to hold their pharmacy license, and that way they don't have to depend on a third person to open a pharmacy. And the salary range that you can expect, if you're working in a medical store, if it's an independent medical store, you can start off anywhere from 15,000 to 20,000. But if you own and operate your own medical store, then your profits and everything together, it depends on how busy your store is, but you can make some pretty good money out of it. It all depends on each store, how busy it is and how much volume of business you'll be doing. But it's a very lucrative business. The wholesale field is also, it's not as intensely competitive as the retail, but the wholesale business is also something that you can look into entering. And these are for business-minded people who want to do their own thing and, are pretty. So that's the Diploma in Pharmacy program for you. Next off, we have Bachelor of Pharmacy or B.Pharm. This is a degree program, which is a 4-year program. To get into this program, you need to have your grade 12 with sciences, and then you get in, and it's a pretty intense course. Again, you have to learn a lot of organic chemistry, calculations, pharmaceutics, and a lot of different subjects like that, and you need to work pretty hard to be able to pass it in the 4 years without carrying over supplementary exams and stuff like that. If you're dedicated and disciplined, you should be able to finish it within the 4-year time frame. Once you finish this 4-year program, you will be graduating with a Bachelor of Pharmacy. So you're a degree holder, first of all. You can use that degree to again register with your local pharmacy council, where you will get a pharmacist license. And again, if you want to go into opening your own medical store or a wholesale store, you can go ahead and do it, but it's like you don't need a degree to do that. If your sole aim is to open a store, then you can actually get away with doing just a diploma in pharmacy. But most of the Bachelor of Pharmacy or degree holders, they do not go into the medical stores scenario, because that's mainly for the diploma guys, because that's what they have meant with their education. People who normally complete the degree courses, they go on to becoming a drug inspector if you can pass the exams. Then some people go on to manufacturing field in different provinces of the country. Some people go into medical representative field. Some people go into academia, or going into postgraduate studies. So these are some of the options that's available after your B Pharmacy. Now about salary. If you choose to work in a hospital, it could be anywhere starting from again 15,000 to 25,000. And if you go into marketing, like being a medical rep, then you can start off with about 25,000 or more. And if you're doing your own business, like opening your own store, again, as I said, it's the same as the diploma guys. So around starting off anywhere from 15 to 25,000. So these are the different options after your Bachelor of Pharmacy. If you go into the drug manufacturing scenario, then you get like analyst or quality control or different jobs like that, and your salary can start off anywhere from again 15,000 to 25,000 to 30,000, and so on and so forth, depending on how many years of experience you'll put in. So people who want to go into academia, like teaching, they usually go the M.Pharm route. So after 4 years of the bachelor's program, they go on to sign up for the post-graduation, which is Master of Pharmacy or M.Pharm. So if your aim is to come abroad, like to leave India, then I request that none of you do the M.Pharmacy, because if you go abroad, your postgraduate degree has no value. You can just say that you have additional 2 years of education, but they only look at your bachelor's degree for licensing purposes or for any basic entry job. So if you're leaving India or looking to have your career abroad, then do your M.Pharmacy after a real good thinking. M.Pharmacy is a 2-year program, and again, as I said, once you're done your M.Pharmacy, then you go on into the academia, like teaching at different pharmacy schools, and you can become a head of the department, and the salary is again not the highest. Maybe you'll start off with anywhere from 25,000. I don't know if you'll even start off from 25,000 when you go into teaching. But again, I'm just saying a ballpark figure of maybe anywhere from 20,000 to 25,000. And then in academia, there's the high-end job like the principal's job, but that's mainly for people who are like having a doctorate degree. So anybody with M.Pharm senior professor or head of the department, they would be ending up there. We have the Doctorate of Pharmacy. The Doctorate of Pharmacy is a 6-year program, and you have 5 years of study and 1 year of internship. You need to again have your grade 12 plus sciences, and then you get into the course and you start your coursework. And once you finished your 5 years, it's also same like B Pharmacy. It's pretty intense. But there's a lot of clinical pharmacy in it. You need to work hard to finish your course in time. And once you pass out of this program, you have a doctorate in pharmacy. You can use the title doctor before your name, as long as it's followed by your educational qualification, which is PharmD. So Dr. Cheryl Syriac, PharmD. So that would be the correct way of. So that's PharmD for you. So what's the scope of PharmD in India? Not very much. Clinical pharmacy or hospital pharmacy or a hospital pharmacist role is not that evolved in India. There's not a lot of collaboration between doctors and pharmacists in a hospital. So if you're planning to do your PharmD, the best option is to look at immigrating or getting out of India. Then you'll be able to practice to your full scope. But if you plan to stay in India and if you plan to work in a hospital, you're looking at somewhere starting salary of again from 15,000, and I don't know what the max salary could be for a pharmacy. All the salaries that I'm saying here is very ballpark. It could be way more or way less, but in my from the friends that I've spoken to and my colleagues, this is what I've learned. Anybody who's working in the field, you can feel free to post your salaries or have a discussion about how your journey was. And the main idea of this video is so that anybody aspiring to go into the pharmacy field can choose or can have an introduction of what the different options are for them, whether it's worth it salary wise, the number of years that you're spending, all that. One other thing that you have to keep in mind when choosing your pharmacy courses, if you're immigrating or planning to leave India and go abroad. For example, in the US, since 2003, Doctorate of Pharmacy or PharmD is the requirement to apply for the US licensing exams. So and in Canada also, the entry to practice requirement is a PharmD, even though the PBCs or the body that licenses the pharmacists in Canada is accepting B Pharmacy for now. It will soon change, and pretty soon you'll need a PharmD to be eligible to appear for the pharmacy licensing exams in Canada as well. So if you have plans to immigrate abroad, make sure you look at your country's requirements and choose your course accordingly. As I said, some countries need the Doctorate of Pharmacy as your entry to practice degree, whereas some countries like in the Gulf, they accept Bachelor of Pharmacy, and depending on which country you want to immigrate to, you can choose your courses accordingly. I hope you found the information in this video helpful. If you did so, please go ahead and like and subscribe. I'll be discussing more about my journey in Canada as a pharmacist, the licensing processes, the different medications that we use on a daily basis, and any other topics that people who want to discuss about in the comments. I can discuss about those topics. I thank you for taking time to watch this video. Thanks a lot.